Welcome to We Are Valley, a podcast by Valley Medical Center, located in Renton, Washington. We Are Valley is dedicated to providing you bite-sized advice to improve your health and well-being, and keep you updated on the latest medical guidance. This podcast is for informational purposes only and is not intended to be taken as medical advice. So please talk to your provider before making changes that will affect your health.
Hi everyone, my name is Alex McGuire. I'm one of the producers of the We Are Valley podcast and your host for today's episode. March is Multiple Sclerosis Awareness Month, a time to promote learning and understanding of multiple sclerosis, also known as MS. The Multiple Sclerosis Association of America's 2025 campaign is titled Empowered from the Start, focused on education, empowerment, and support for individuals who are newly diagnosed with multiple sclerosis. In this spirit, we've asked Dr. Beth Schlamon of the Neuroscience Institute to join us today and help us answer some common questions about MS. Welcome to the podcast, Dr. Beth Schlamon. To start, could I have you introduce yourself for our listeners?
Hi, I'm Sargon Betschlimon, and I'm a neurologist here at Valley Medical Center. Before I was here at Valley, I did my residency and fellowship training at the University of Washington, and I specialize in multiple sclerosis and neuroimmunology.
Awesome. Thank you again so much for joining us. I'm really excited to have you here to help us answer some of these questions, but let's start it from the basics. What is multiple sclerosis?
Yeah, so multiple sclerosis, or MS for short, is a disease in which the immune system, which is normally fighting infections and other things like that, actually attacks the nervous system, and in particular, the central nervous system, which mainly comprises of the brain, the spinal cord, and the optic nerves. And in particular, the immune system likes to attack this substance called myelin, which is basically an electrical sheathing around nerve cells, which helps them conduct signals. So that's what is attacked in MS, and that's why it's sometimes called a demyelinating disease.
Yeah, that makes sense. MS is a demyelinating disease because the myelin is what's being attacked. Do we know what causes MS?
We don't. So we know that there are genetic and environmental factors at play. There's a lot of research about different things that can increase a patient's risk for MS, but we don't have an exact cause pinned down.
Well, hopefully in future MS months, we'll be able to come back with updates as the research advances, and maybe we'll get more of a picture.
Yeah.
So then, what kind of symptoms does MS typically have? What are things to look for if you might think you have MS? Or what are the things to look for that might mean that you have MS? So then, what kinds of symptoms does MS have? Are there things to look for that might mean that you have it?
The signs and symptoms can really vary. And the reason is that a lot of symptoms in MS come from specific areas of the nervous system being damaged. And so if there is one particular area that's being damaged during part of someone's course, then they might have one symptom, whereas if a different part of the nervous system is being damaged, they could have a totally different symptom. And those kind of symptoms can exist in the same person. Different people might also have different manifestations. And oftentimes these symptoms, after they come on, they'll often improve, especially early on when someone has the disease. And so that's why it can often be difficult to make a diagnosis, especially if things get better, they're attributed to something else. And sometimes it takes a few instances of symptoms before someone puts together the pieces and realizes that this is a neurologic disease. But broadly, you can have symptoms ranging from vision changes to changes in sensation or walking and balance, even changes in bladder or bowel function.
Right. So because it's a disease that affects a lot of places along our nervous system, there's a pretty wide range of symptoms, and those symptoms can be different from person to person. What does that mean when it comes to getting a diagnosis? How do you diagnose somebody that has MS?
So we don't have any one specific test to diagnose MS, unfortunately. And so what we do is we use a set of diagnostic criteria which take into account someone's symptoms, their neurologic examination findings, imaging findings from MRI, and even lab findings. And so if someone meets those criteria, then as long as we don't have some other explanation for their symptoms, then they could get a diagnosis of MS. That other explanation of symptoms means that we also often have to look for other things and exclude other causes of symptoms before we attribute them to MS.
So it takes a lot of different pieces of the puzzle to really build the picture then. Is MS permanent? Are there treatments for it?
I wish there was a cure, but there is no cure. And so it's a chronic illness that people carry with them throughout the duration of their lives. That being said, we do have treatments, and a lot of the treatment of MS focuses around preventative treatment. So taking medications that reduce the risk of damage to the nervous system and ultimately reduce the risk of accumulating disability down the line.
If you find out you or someone you love has MS, should you be worried about spreading it? Is MS contagious? Is it hereditary at all? Should I warn my family members if I find out that I have it?
MS is not contagious. It's not an infectious disease. But the question of whether it's hereditary is a little bit more nuanced. So it's not hereditary in the sense that you are definitely going to have MS passed on from parent to child in the way that we think of some hereditary diseases, but there is a very small genetic component of increased risk if you have a first-degree relative with MS. It's relatively small. That's why we don't consider it to be a hereditary disease, but there is a very small genetic component there.
One of the things that I came across in researching and preparing for this episode is that MS is seemingly more common in the Pacific Northwest. Do we have any idea why that is?
Yeah, that's only something that people have noticed is that MS is more prevalent, not just in the Pacific Northwest, but other areas at high latitudes. And there's some theories about this. One thing that may factor in is sunlight exposure and vitamin D levels. There's some evidence that draws an association between low vitamin D levels and risk of developing MS or risk of worsening MS. And then the other factor that may be playing into that is people's genetic background. So MS tends to be more prevalent in people of Northern European descent, and we have a lot of those folks here in the Northwest.
So let's say someone just got diagnosed with MS. What are some of the ways it might impact their life? It's a chronic condition, which means that it can't be cured. What does that look like? Will symptoms ever worsen over time?
You know, it's really hard to say because it can be variable from person to person. So some patients might go their entire lives with very few symptoms or have kind of minimal impact of the disease. Other patients might be more severely impacted. So it really is hard to say from one individual to another. What we do know is that being on preventative medications for MS will reduce the risk of disability later on and improve chances that people will have less impact as they go on in their life.
What about lifestyle changes? Are there things like diet or exercise that you should be considering if you get diagnosed with MS? Or are there things that you should be steering clear of if you get diagnosed with MS?
So people often ask about lifestyle changes in MS, and there's a few things that we know, but there's a lot of things that we don't know. So one thing that is very, very clear is that if you are a smoker, you should stop smoking, not only for your general health, but we do know that people who smoke tend to have worse MS over time compared to people who don't. In terms of things like diet and exercise, there's been a lot of diets that have been tested or proposed in MS, but there's nothing that's been proven to be beneficial. No one diet has been proven to be helpful more than another. So what I often recommend to my patients is eating a diet that is heart healthy, basically, and one of the ones that has been best studied in that context is the Mediterranean diet. And the reason for that is, again, not only your general health, but we do know that people who have uncontrolled cardiovascular disease also tend to have worse MS with time. So in that same vein, keeping up a good regular exercise schedule is also a good idea. When it comes to MS, the other things to consider would be making sure that you are doing exercises that work with any physical limitations that you might have related to MS. And the other thing to keep in mind is that people with MS will often report a temporary worsening of some of their symptoms when they're exercising more strenuously. And that's something that relates to increases in your core body temperature. It's not unique to exercise, and it can happen in other situations. But the important thing to know there is that those changes are temporary. They don't indicate new damage or harm coming to you from MS, but it's something to be aware of that some people often will notice. The last one that might be a good idea, and this should be in consultation with your doctor, would be vitamin D supplementation. People often have low normal vitamin D levels that need to be supplemented. But again, that's something that should be discussed with the doctor.
And then one of the things that I've heard about in relation to people with multiple sclerosis is that sometimes they get flares. What do we mean when we say that? What's happening in an MS flare?
So an MS flare, which also goes by a handful of other names that all mean the same thing: exacerbation, relapse, attack. What that is when the immune system attacks a particular part of the nervous system and produces symptoms that are referable to that part of the nervous system, depending on what that part does. So for example, if someone has an attack that involves the nerve behind the right eye, they might have blurriness and pain when they move the eye. So that would be an attack in the eye. But if, for example, they had an attack in the spinal cord, they might have, say, changes in sensation from some part of their body downward. So the attack basically reflects an area of damage that is going on in one particular part of the nervous system that is causing symptoms. And if we're going by a strict definition, then the duration has to be at least 24 hours. But that being said, realistically, these attacks are usually much longer. So usually symptoms will come on over a day or a few days. They will usually last for days to weeks at a time. And then they'll usually slowly improve after that to variable degrees of improvement, depending on the attack and depending on the person.
All right. And just like that, we're already at the last question. Dr. Betschlemon, what advice do you have on supporting loved ones with MS? How can we show up for those with MS in our lives?
This is a chronic illness that has a lot of ups and downs. And so I think just being aware of the fact that people do have times when they're going to be more affected, times when they're going to be less impacted, and being able to be emotionally there for them and supportive of them through those times is probably the best thing that you can do as a friend or family member of someone with MS.
I think that's a really great note for us to end on. Folks, if you or someone you love has multiple sclerosis, also known as MS, or other neuro conditions, and are looking for a specialist to help them with their long-term care strategies, you can learn more about the Neuroscience Institute and Dr. Betschlemon by using the links in our episode notes or by going to our website at valleymed.org/neuroscience. Dr. Betschlemon, thank you again so much for joining us today.
This has been We Are Valley, a podcast produced by Valley Medical Center in Renton, Washington, as a part of our mission to care for our community like family. If you liked this episode, be sure to subscribe to our feed for more great health content. And for more health resources or to find a provider, visit valleymed.org. Thank you for joining us.